Welcome my friends to my channel. I'm Bob Schrupp, physical therapist, providing you with free physical therapy treatments that you can do yourself in your own home, which I think is pretty cool. Today we're going to talk about tennis elbow. This is a real bugger, isn't it? This is something that can be very, very painful. I think people are quite shocked how painful it can be. It's something that you're going to feel when you grip, bring your wrist back. Sometimes when you bring your wrist back, or even sometimes when you bring your wrist to the, towards yourself this way. You can feel it in the forearm here. And again, you have my sympathy because I know this is a very painful condition. Now this is something you can try. It's going to help some of you it's not going to help, but it's definitely worth the effort, worth the trial. First off, you should be icing the thing, which you probably are doing already. You want to put some ice right on the elbow itself. Tennis elbow tends to affect the muscles that are running from what we call the lateral epicondyle, the bump on the outside of your arm here, not the inside. That tends to be more golfer's elbow. So what we're going to be doing here is, you can feel this bump right here, and the muscles coming off of that. That's where we're going to be working on. And we're going to be trying some cross fiber friction massage. I want you to have a pillow, and I want you to put it underneath your arm, keeping your arm nice and relaxed. And you're going to have your palm down, okay? Palm down, and you're going to go to the outside of your arm here, and using a couple fingers, two together like this, or one on top of the other, or you could even do three, in various combinations there. But what you're going to want to do is you're going to try to find the tender spot, because you feel the bone. Ideally, the ones that it helps the most are the ones that are off the bone. The ones that are not, it's not the tendon attaching to the bone, it's the tendon a little further down. And you're going to find the tender spot, and you're going to rub across that tendon fairly hard. And you should find, it should be a tender spot, so you should know which spot you're working on. Now, I'm not just moving skin here. I'm rubbing in there fairly aggressively. Now, what this is going to do is two things. One, it's going to get more blood flow to the area, hyperemia as they call it, I believe. And two, it's going to help realign the fibers, because what happens with tennis elbow is the tendons, they've had some abuse to them, they've had some overuse injury. If you're a tennis player, that's from that, but quite often it's from other things, obviously just the work environment. And there's some minor tears in there, or they've been strained or frayed and somehow. And the fibers are not aligned right. They're healing like a web, in a web-like fashion. So we're trying to realign them so they're strong, so they don't hurt anymore. So again, outside elbow, arm relaxed. You're going to find the tender spot and you're going to rub across it. Now you can do this for, by the way, what you're looking for here, this is the key to this treatment in a sense, is that after a minute of doing this, if the pain just keeps getting worse and worse and worse, it's too soon to be doing this. You got to put some ice on it and follow other recommendations of rest, and maybe even a little bit of ibuprofen or something like that if your doctor recommends that. But what you want to find is that after a minute or so of doing it, the pain level actually kind of starts to level off or go down, or it feels numb. That's a good sign. That means that this has a good chance of working. So you're going to do it for a good couple of minutes, and you can do it up to 5 minutes for the total treatment. And you can do this every day. A good one to do just, when you're at work, if you're in your office chair while you're taking a break, because I know we're all busy and we don't have time to do these treatments. But give it a try. Again, some of the ones that attach to the bone, you can try it. It's less likely to help. You may need some other physical therapy treatments for that one, but this is a good one to try for the tendon that's coming off the bone. Good luck to you, and please leave your comments below. I'd also appreciate if you want to, provide me with some ideas on videos that you'd like to see from a physical therapist, and please subscribe. Thanks a lot.